Welcome to the deep dive. We're here to, cut through the noise and get straight to the insights you need. If you've been following health news lately, well, there's a lot of talk about these new weight loss medications, especially the GLP-1s.
Mm-hmm.
And maybe you've wondered how they work or who can actually get them. And probably the biggest question, are they covered by your health care?
Yeah, it's the big one.
So today we're doing a deep dive specifically for you, especially if you're connected to the military community, families, veterans, anyone navigating TRICARE. We're focusing right in on TRICARE's coverage for these weight loss drugs.
Exactly. And our mission here is really to unpack the latest info straight from TRICARE. We want to make it clear, what's covered, who it's for, and what steps you actually need to take.
Right. The goal is clear, actionable insights. We want you to feel informed, but not overwhelmed by all the jargon.
Definitely. And just to kick things off with something really important, August 31st, 2025. You might want to note that date down.
Okay. Why that date?
Well, it's not just random. It's actually a pretty significant deadline that affects existing approvals for certain weight loss meds under TRICARE. We'll get into that.
Okay, August 31st, 2025. Got it. Let's dig in. So these GLP-1 drugs, like Wegovy and Zepbound, they're everywhere in the conversation about weight loss now. It's undeniable.
Mm-hmm.
But maybe first, just a quick refresher for anyone less familiar. GLP-1s, they stand for glucagon-like peptide-1 agonists.
Right. They're basically a class of drugs that mimic a hormone your body naturally makes. This hormone helps regulate blood sugar, it slows down digestion, makes you feel fuller.
Which explains why they work for both diabetes and weight loss.
Exactly. And that distinction is key for TRICARE.
Okay, so diving into TRICARE's stance, you mentioned Dr. Paul Quartz, the Defense Health Agency CMO.
Yes, and he really stressed understanding how and why TRICARE covers these drugs. It depends heavily on your specific condition, like diabetes versus weight loss, and also your beneficiary status.
Right, it's not a one-size-fits-all approach.
Not at all. And this brings us right back to that critical date, August 31st, 2025. The Defense Health Agency is putting new regulatory controls in place for weight loss drug coverage, effective then.
Okay, new controls. What does that actually mean for people? Is coverage just stopping?
Well, here's the nuance. It's not a complete stop for everyone. If you have TRICARE Prime or TRICARE Select, coverage can still be there under certain conditions. But, and this is the crucial part, any previously approved prior authorizations for weight loss drugs, they expire on that date, August 31st, 2025.
Wow, okay. So even if you had approval before, it's gone after that date.
For weight loss specifically, yes. It means you'll need to go back to your provider. You'll need to discuss your options again, maybe reestablish the medical necessity according to the potentially updated criteria.
So it's a major reset. Like TRICARE is drawing a clearer line between managing weight and treating a disease like diabetes.
That seems to be the signal, yes. A more conservative approach to just weight management.
Okay, so let's break that down then. Let's talk about the weight loss medications first. TRICARE does cover some specific ones, right? You mentioned Saxenda, Wegovy, Zepbound.
Mm-hmm. Also, Qsymia, Phendramine, and Contrave are on that list for weight loss.
But who qualifies? It's not everyone on TRICARE.
Correct. You generally need to be enrolled in either TRICARE Prime or TRICARE Select.
Those are the main plans for active duty families and many retirees.
Right. Or you could be covered if you're on one of the premium-based plans.
Premium-based, like TRICARE Young Adult.
Yes. Young Adult, also TRICARE Reserve Select, TRICARE Retired Reserve, and the Continued Healthcare Benefit Program, CHCBP. Basically plans where you're paying a monthly premium.
Got it. But just being in one of those plans isn't enough, is it? There are requirements.
Absolutely crucial. There are 3 key things, and you need all of them. 1, you have to meet TRICARE's specific clinical criteria for weight loss medication.
Okay, like BMI thresholds or related health conditions, probably.
Presumably, yes.
2,
you need a prescription from a TRICARE network provider.
Makes sense.
And 3, that provider must submit a prior authorization form.
Prior authorization. That means getting TRICARE's approval before the prescription can be filled.
Exactly. Your doctor has to essentially make the case to TRICARE that the medication is medically necessary for you, based on their guidelines, which can be pretty strict.
Okay, that's a clear process for weight loss. Now, how does this compare to using the same types of drugs, like GLP-1s, for diabetes? Because you said that's different.
It really is quite different. For treating type 2 diabetes, GLP-1s continue to be covered for all TRICARE patients who have that diagnosis, provided, of course, it's deemed medically necessary, and any prior authorization needs are met for the specific drug.
So the coverage is broader for diabetes treatment. Which drugs fall under this?
For diabetes, the list includes Trulicity, Ozempic, Mounjaro, and Victoza.
Okay, and I think you mentioned something specific about Ozempic, Mounjaro, and Victoza.
Yes, for those three specifically, there's a medical necessity form required to get the standard formulary copayment, and also for getting coverage if you fill it at a military pharmacy.
So an extra form, but the coverage is there. And the cost for diabetes patients.
Good news on that front. The existing cost shares, what you pay out of pocket for these diabetes medications, those have not changed.
That's a relief for many, I'm sure. So diabetes treatment is stable, but weight loss coverage is seeing significant changes, especially with that 2025 date.
That's the core distinction, yeah.
Well, to be absolutely clear, who is definitely not covered for these weight loss medications under TRICARE?
Okay, the exclusion is pretty clear here. If you have TRICARE For Life.
That's the coverage for people eligible for Medicare. Right.
Correct. So TRICARE For Life beneficiaries are not covered for these weight loss drugs. Also, those who only have access to direct care, meaning care just at military hospitals or clinics, they're also excluded from this specific weight loss medication coverage.
Okay, so TFL and direct care only are out for weight loss meds. This naturally leads to, well, what do people do now? What are the options and next steps?
Yeah, and the number one piece of advice from TRICARE is consistent. Talk to your provider.
Always the best starting point.
Absolutely. They are essential for confirming what a drug is actually approved for, its indication, and figuring out if that prior authorization is needed for your situation.
They know your health history. They know the TRICARE system, hopefully.
They should. And they're your best resource for navigating your specific coverage details.
What if a weight loss drug just isn't covered for someone? Are there other paths TRICARE supports?
Yes, definitely. And it's important to remember this. If a specific medication isn't an option, you're not just left hanging. Your provider can and should discuss alternatives, things like nutrition counseling, making lifestyle and exercise changes.
The foundational stuff.
Exactly. Or other clinically appropriate methods that might work for you. Your provider helps explore all of that.
That's good. And you mentioned TRICARE points to some resources.
They do, which is helpful. They highlight a couple of key tools.
Like,
well, first, there's the TRICARE Formulary Search Tool online. It's really useful. You can use it to check if a specific drug is covered, see what the cost might be, and even download those prior authorization forms if needed.
okay, that sounds practical. Anything else?
They also mentioned the health and wellness section on the TRICARE website. That area has broader resources, more information to help you reach your general health goals beyond just medication.
So tools for specific drug info and broader wellness support, good to know.
Yeah, they're trying to provide pathways,
It seems like while the medication discussion is huge right now, TRICARE and the source material we looked at really emphasize something broader too, which is the ongoing importance of just healthy habits.
Oh, absolutely fundamental. Even if you are taking medication for weight loss, building and maintaining those healthy habits is crucial. It's what makes the weight loss or weight management sustainable long term.
What kind of habits do they specifically call out?
The basics, really, but they're key. Eating a balanced diet, getting regular exercise, and also cutting back on things like alcohol.
Right. It's about building that solid foundation for health. The medication might be a tool, but it works best with the lifestyle changes.
That's the message, loud and clear. It's about synergy between medical help and personal habits.
Okay, so let's try to synthesize this. What's the absolute bottom line for you, the listener?
I think the main takeaway is TRICARE can cover certain weight loss medications, including some GLP-1s, but, and it's a big but, it's only when specific criteria are met.
Right. Based on your diagnosis, proving medical necessity, and importantly, which TRICARE plan you have.
Exactly. And remember that August 31st, 2025 date looms large for existing weight loss prior authorizations.
So the most important action item.
Without a doubt. Talk to your provider, seriously. They're the ones who can confirm if a specific drug might be covered for you, navigate the prior authorization if needed, or help you explore all the other options if it's not.
That conversation is key.
It really is. And thinking bigger picture for a moment, this whole situation, it's kind of a microcosm of modern healthcare, isn't it?
How so?
Well, it shows how navigating your benefits, especially with new popular treatments, really requires you to be proactive. to ask questions, to understand the rules.
You have to be engaged.
You really do. Your personal health journey today often involves blending these, cutting-edge medical advances with those timeless, foundational, healthy habits.
Finding that balance.
Precisely. So maybe a final thought to leave you with is something around that balance. In a world where exciting new treatments pop up all the time, how do we, individually and maybe even systemically, best balance chasing those specific medical solutions?
Like a weight loss drug.
Right. With the perhaps less glamorous but incredibly powerful work of cultivating sustainable lifestyle changes for genuine long-term well-being.
That's definitely something to think about. Where do we invest our energy and focus for lasting health?
Something to mull over.